Hello future doctors, how are you all? Welcome back to MedSteps YouTube channel. So today we are diving into an essential pathological topic, that is cellular adaptations. So this is high yield not only for exams like FMGE and NEET PG, but also critical for understanding how our body copes with stress at the cellular level. Okay, so myself, I am Anandjana, final year medical student. So what are cellular adaptations? The cellular adaptations are reversible changes that occur in cells in response to stress or injury. These changes help cells survive in new conditions. The adaptation can be, it may be like physiological and some pathological also. So first we are going to discuss about physiological. In physiological, for example, that uterus enlarges during pregnancy due to hormonal stimulation. You can see in physiological you can see uterine enlargement during pregnancy. So it will comes in physiology. So it will comes in physiology. Why? Because that in pregnancy time that mother uterus have to increase size, because inside the uterus that baby is growing, that's why. Okay, so it will comes in increasing size, then trophy. So that's why it will comes in physiology. Next, pathological cellular adaptation. In pathological we can see like thickening of the left ventricle in chronic hypertension. So in pathological we can see like myocardial hypertrophy secondary to systemic hypertension. Okay, so here main point is you have to remember, if the stress continues for too long or becomes too severe, the cell can't adapt anymore. It goes from adaptation to injury. So and it leads to cell death, okay, either by necrosis or apoptosis. If you don't know about necrosis and apoptosis, I already made one video about this thing, so you can go and visit that video. Okay, so now we are going to see the types of cellular adaptations. So before that why we have to know this thing? This based on, because of the cellular adaptations we have some different things. For example, hypertrophy. Hypertrophy means hyper means increase. Hyper means like increase in cell size, then we call that is hypertrophy, not in number, in size. This occurs due to increased demand like in muscles after exercise or in the heart due to hypertension. At the cellular level, hypertrophy is due to increased synthesis of structural proteins and organelles. So increased structural proteins and organelles increase in size of cells is known as hypertrophy. So in example, the left ventricular hypertrophy in hypertension we can see in our medical field, but if this becomes excessive, it can lead to heart failure due to damage to the muscle fibers. Okay, so that's why we have to know this hypertrophy and hyperplasia and this thing, because this is very basic pathological conditions we can see in our daily in medical fields. Okay, so next one, hyperplasia. Hyperplasia is an increase in number. Hyperplasia means increase in number of cells. Like this happens through controlled like proliferation of stem and mature cells. Okay, it controlled by proliferation of stem cells and differentiate cells, or you can tell mature cells. So how this thing is happening? Excessive stimulation will comes in pathological hyperplasia. Okay, in pathological hyperplasia you can see like endometrial hyperplasia. Okay, it's like gynecological problem, and that patient will get because of too much excessive estrogen, which can progress to dysplasia, and then eventually it will go to cancer also. Okay, so that's why we have to know about this pathological conditions of the hyperplasia. In endometrial hyperplasia, that a female, that she will have too much bleeding. So because of that bleeding we have to treat this endometrial hyperplasia. Okay, in physiological, what are the where we can see this physiological hyperplasia means it's like the endometrial lining thickening in response to estrogen. Okay, endometrial hyperplasia which may progress to dysplasia and cancer. Next one, atrophy. Atrophy, A means absence, trophy means size. So atrophy means decrease in tissue mass due to either like decreased size of cells or decreased number of cells. Why does it happen? Because disuse, that means that patient is not using that hand, that's why, like a limb in a cast. If any patient have some cast in hand, so that we have to do immobilization. So because of that immobilize, we can see atrophy and like denervation and because of decreased blood supply and malnutrition or loss of hormonal stimulation, this everything can cause atrophy. What are the mechanism involved in atrophy means it's like ubiquitin proteasome pathway. Okay, the what we can see in atrophy, we can see like decreased in tissue mass due to decrease in size. So we can see like increased cytoskeleton degradation via ubiquitin proteasome pathway and autophagy means self dying and decreased protein synthesis. So for protein degradation, we call we have one pathway, that is ubiquitin proteasome pathway, and we can see like autophagy. Autophagy means where the cell digests its own components, that thing we call autophagy. Okay, and we can see number of cells like apoptosis. Causes include disuse, denervation, loss of blood supply, loss of hormonal stimulation and poor nutrition. We already discussed this thing. Next one, metaplasia. Metaplasia is a change from one cell to differentiated cell to type to another. It's a reprogramming of stem cells to adapt to a new stress or irritant. So for example, in smokers, if you are seeing means in smokers we can see respiratory ciliated columnar epithelium, but it gets replaced by stratified squamous epithelium, so it can leads to cancer. Okay, like if any patient have chronic acidic reflux, that patient we can see in esophagus, like that esophagus, in esophagus we can see some cells, that is squamous epithelial cells. It changes into intestinal columnar epithelium. So this is one pathological condition we call, that is Barrett esophagus. Okay, this is like very important. Why? Because this metaplasia is reversible if the irritant is removed, but if it persists, it can lead to dysplasia and eventually it can lead to cancer also. So that's why it's very important. So for knowing cancer and these things, we have to know these basic concepts. Okay, so as this metaplasia can occur in connective tissue like myositis, ossificans, where bone forms in muscles after trauma. Okay, so this is very important. Next one, we are going to see the dysplasia. In this dysplasia, we can see like dysplasia means it's like disordered precancerous cell growth, and it is not a true adaptive process. Okay, so what are the features included in dysplasia means loss of uniformity in cell size and cell shape, we call that is pleomorphism. Okay, characterized by loss of uniformity of cell size and cell shape, we call that is pleomorphism. And we can see in dysplasia disorganized tissue architecture and increase in nuclear to cytoplasmic ratio and hyperchromatic clumped nuclei. So mild to moderate dysplasia may be reversible if the cause is removed, but in severe dysplasia, it's involving the full thickness of epithelium, is considered like carcinoma in situ and is often irreversible. If you see in this image, you can see hyperplasia means increasing in number of cells. Okay, you can see here. Hypertrophy means increasing size. Atrophy means absence of size. Okay, so and this is normal cells, and it will be like this increasing in size and increasing in number of cells. It will be like reversible. Okay, if the cells changed in type and structure, So then it will becomes like general, it will becomes like irreversible, because it can lead to neoplasia, means tumor or cancer. So sometimes we can say dysplasia and metaplasia. It's like reversible, and changes in cell structure means we call that is dysplasia. If changes in cell type means we call that is metaplasia. Okay. In chronic irritants like persist, it's irreversible because it will leads to neoplasia. Okay. So that's why this topic is very important. If you have any doubts, you can ask me in the comment section. So before ending this video, I have to give little recap. Hypertrophy means increasing in size. Okay. Cell size. Hyperplasia means increasing number of cells. Atrophy means decreased cell size or decreasing number of cells. Next one, metaplasia means change in cell type. Dysplasia means disordered cell growth, like precancerous cell growth. Okay. If cells can't adapt, then we call that is irreversible injury. It can lead to necrosis or apoptosis. So understanding these adaptations helps you to interpret disease and mechanisms and pathology much better. Okay. So if you found this video is helpful for you, don't forget to like, share and subscribe. We will meet in our next video. If you have any doubts, you can drop me a message in comment section. Take care. Bye bye.